The human immunodeficiency virus and the acquired immune deficiency syndrome, commonly referred to in conjunction as HIV/AIDS, is a deadly infectious disease spread through the transfer of blood. HIV is particularly prevalent in sub-Saharan Africa, and in this presentation we will evaluate the economic, political, cultural, and health-related impacts that AIDS has had on the country of South Africa specifically, as well as on the international scale. To start out our evaluation of the impacts of HIV at local to international scales, let's look at the geographic impacts the virus has had on the province of KwaZulu-Natal in South Africa. Many local areas in South Africa have faced major risks to development due to HIV/AIDS, and KwaZulu-Natal is one of the hardest hit by the epidemic. 26.4% of KZN's working-age population is HIV positive, compared to 15.9% in the rest of the country. According to the KwaZulu-Natal's Research Institute for Tuberculosis and HIV, 17% of central KwaZulu-Natal is infected by HIV, and up to 80% of adult TB victims in the region are also HIV infected. Between 2000 and 2003, life expectancy in KwaZulu-Natal fell from 59 years to 52 years. According to the U.S. National Library of Medicine, given the demographic projections, HIV/AIDS will reduce KZN's overall population growth rate from an average 1.85% from 2002 to 2025 in the no-AIDS scenario to 0.79% in the AIDS scenario. The leading causes of death in KZN are infections associated with HIV/AIDS, such as influenza, TB, and pneumonia. KwaZulu-Natal province hospitals serve as epicenters of the AIDS pandemic. Doctors and nurses who fall victim to HIV cannot work in the region's hospitals, further increasing the lack of skilled health professionals in the province and resulting in less attention paid to all kinds of medical issues, not just HIV. Less available healthcare means that medical costs are rising. These increased medical costs could potentially increase income disparities in the region and put even greater pressure on local governments to fund anti-HIV programs. And this increase in healthcare costs will be even more difficult to handle considering the fact that HIV/AIDS lowers KwaZulu-Natal's GDP growth rate by 1.6% per year. HIV prevalence is concentrated among working-age South Africans, which decreases economic efficiency and productivity. On the other hand, it has also been noticed that disproportionately many HIV victims in KwaZulu-Natal were unemployed before becoming infected. This unemployment was likely a contributing factor to the infection, and so mortality among HIV victims has not made the same devastating economic impact on families and communities as it has emotionally. As of 2011, KwaZulu-Natal remains South Africa's most affected province, with an antenatal HIV prevalence of more than 40% in 2 of its districts and more than 1.6 million people living with HIV. This high antenatal HIV prevalence in particular will likely haunt the region in years to come, as the next generation is born into a world already infected with HIV. Now let's look at the bigger picture. There are various impacts that HIV has had on the national level in South Africa. Economically, HIV has made a big dent in South Africa's GDP per capita growth. According to the Global Health Initiative report, South Africa's projected GDP per capita growth for 2012 without HIV would have been 0.9 percentage points higher. Furthermore, because so many people in South Africa have contracted HIV, industries have had an increase in absenteeism, turnover, and healthcare costs. In 2000, the second largest South African company reported that 15% of its workers were HIV positive. HIV has kept a large portion of the South African population in poverty. HIV victims cannot hold down jobs, and about 1.2 million orphan children in South Africa are left to support themselves or rely on South African government support. HIV mortality has led to an increase in the dependency ratio in South Africa, which does nothing positive for the economy. This trend becomes even more troubling when it is revealed that birth rates have remained higher than predicted, perpetuating this high dependency ratio. These continued high birth rates are due in large part to HIV-inflicted poverty in South Africa and the resulting low sex education. According to a paper prepared for the African Development Forum, population growth for South Africa without AIDS would have been 1.5 percentage points lower without the high birth rates associated with HIV. Since 2007, however, national AIDS prevention campaigns have been launched aimed at educating the South African population about safer sex and health habits. In this way, the crushing AIDS epidemic in South Africa, the country with more HIV victims than any other in the world, has called for more open conversation about national health, which could potentially benefit the country in years to come. In terms of individual well-being of South Africa's citizens, a significant problem is HIV's co-infection with TB. According to the South Africa Country in Progress report, it is estimated that 1 out of every 3 people with HIV in South Africa will contract TB sometime in their life. Sub-Saharan Africa is the region most drastically affected by HIV/AIDS in terms of population health and well-being. The early 90s saw a huge drop in life expectancy, while in other regions, such as Europe, Asia, the Americas, and even Western and Northern Africa, continued along normal trajectories. Central Africa also saw a slight dip after the HIV outbreak. Internationally, HIV has had a minimal economic impact. There are many regions, such as North America and Europe, that do not have high populations of HIV victims. For these regions, HIV's economic impact has less to do with domestic economic problems and more to do with decisions concerning international government aid to countries like South Africa. How much money should HIV-troubled nations receive from abroad to reduce the spread of the virus? Countries like Kenya and Bolivia depend almost entirely on foreign aid to fund anti-HIV programs. And while global HIV expert Bernard Schwatlanda says that the world should move away from heavy international aid, it only promotes dependency in his opinion, he recognizes the fact that the spread of HIV has made international aid all the more important. The economic relationships between LEDCs and MADCs can result in lots of tension. The UK's recent decision to stop aid to South Africa by 2015 has caused uproar in the South African government, for example. Tensions developing from HIV-targeted international aid can negatively affect government relationships, as it has between the UK and South Africa. HIV/AIDS awareness has spread dramatically since the 1980s, especially in Europe and North America. This may explain why HIV rates are considerably lower in these regions. International pressure on South Africa was a driving force in the South African government's recent endorsement of HIV prevention programs, and billions of dollars are spent globally each year on anti-AIDS campaigns. Obviously, minimizing the negative impact of HIV/AIDS is a top priority in the world at the moment, and likely will continue to be one until HIV has lost its powerful grip on sub-Saharan Africa, South Africa, and the province of KwaZulu-Natal.